Good morning, everyone. Welcome to the morning meeting. Thank you so much for joining us today. We really appreciate everybody dialing in on this very icy morning here in Columbus. How is it around the state? I was talking to my best friend in Cleveland this morning. It sounded cold up there too. Yep. Everyone's chilly. Well, thanks for calling in. We're going to warm you up with a great conversation. We have wonderful guests today. Before I kick it over, I'm just going to share a brief legislative update. We are still looking at the January 30th deadline for congressional appropriators. However, we're seeing traction on the childcare spending at the federal level. We've seen the House come around to close to the Senate levels of appropriation in most of the childcare related line items. So very encouraging to see that. But we don't want to let our foot up off the gas. So our team will plug the action alert that we have going to just keep that positive momentum going. Let our legislators know we do still want them to appropriate for young children. And then hopefully they come through for us and we can do a nice thank you campaign here in the next few weeks, fingers crossed. At the State House, we saw two bills come out last week related to childcare, publicly funded childcare oversight. There is a Senate bill, nope, House bill 647, sponsored by Reps Plummer and Young, that was presented at a press conference alongside with Director Wente. And there is also House Bill 649, which was introduced by Representative Josh Williams from the Toledo suburbs and Rep. DJ Swearingen from Huron. That bill press conference also featured Attorney General David Yost. So lots of conversations happening at the State House. They are not back until February for any hearings in the House. So we are keeping our ear to the ground about any opportunities for testimony and doing some bill analysis ourselves. No appropriations in the Williams bill. There is a $5 million appropriation in the Plummer bill that we think is from we know is from the child care cred programming. So still more to come on that. It's very early stages. Both of these bills were just introduced last week, and we'll be sure to let folks know opportunities for engagement moving forward. If there are any questions about that, feel free to tap me in the chat or offline. I want to pass it over to our wonderful friends, Reem Aly and Katherine Bissett from the Ohio Alliance of School-Based Health, Ohio School-Based Health Alliance, excuse me. Reem has been the executive director, and she is a former ground worker, we have to say. As the organization's first full-time executive director, she's been responsible for the growth and sustainability of this wonderful statewide organization, advancing high-quality school-based health services to support the health and success of Ohio's children and families, as well as schools and communities. So Reem brings lots and lots of years of policy and advocacy and leadership experience to this role, with a deep background in research and data. And she has led many numerous is a little bit redundant, many statewide initiatives focused on improving maternal and young child health and wellness. So we're super happy to have her here today and joined by Katherine Bissett, who serves as the Alliance's Director of Initiatives, providing leadership and oversight to the organization's capacity building, technical assistance, and outreach programming. Katherine was just sharing she's a nurse by trade, and she brings, I think somebody might be off mute. Here we go. And she brings extensive experience in the last decade, having focused on developing equity-focused school-based health programs in Maryland and Ohio. So we're really excited to have you both. I don't want to take up any more time. I'm going to pass it over to you to share your slides. If folks have questions throughout, feel free to put them in the chat, and we'll reserve a few minutes at the end. Thanks for being here.
Well, thank you, Brittany, and thank you for that very lovely introduction. And it's good to see everyone on this cold and chilly morning. We're hoping that we can start your day off right with some good conversation. So, Reem Aly, Executive Director of Ohio School-Based Health Alliance, and we're going to give you a little bit of information about the work that we do, and particularly about school-based health centers to help arm you with all of the knowledge as you're going about your work and also your advocacy for children in Ohio. So we can move to the next slide. A little bit of information about the Ohio School-Based Health Alliance. So we are a nonprofit, independent, statewide organization, and we were created to advance the sustainability and expansion of school-based healthcare. And you're going to get to hear from Katherine Bissett, who's our Director of Initiatives, more on what we mean when we talk about school-based healthcare. And our mission aligns right with Groundwork in that we're trying to advance equity and improve health and education outcomes for students, their families, and communities, which of course, children are at the core and the center of the work that we do. Next slide. These are what we call our buckets of work. So our work is categorized into these three areas of focus. We provide capacity building supports to our partners across the state. That looks like technical assistance, on the ground technical assistance to help support school-based health centers and other school-based healthcare partnerships. We also advance policy transformation, which is the fancy way of saying education and advocacy around school-based healthcare. And then data tracking and evaluation is a core pillar of the work that we do. So we always want to be armed with the data and the information to ensure that we are showing how school-based healthcare is making an impact on children and their families. All right, I'm gonna give you a little bit of the synopsis or the landscape around school-based health centers in Ohio. And then Katherine is going to give you more of the nuts and bolts of what we're talking about when we say school-based health centers, and then how does this intersect with your core focus area, which is kind of a 0 to 5 space. So just as kind of a high level overview, yes, Rhonda, I will speak louder. I am so sorry. I am just getting over a bad virus, and so my voice is a little bit in and out, but I'll get a little bit closer to the speaker, and hopefully you all can hear me a bit better. So just to give you a bit of context or backgrounds around the funding and investment in school-based healthcare and school-based health centers, and particularly our governor is a strong champion of school-based health centers. And when I came into my role, there had been no state investment in the state budget in school-based health centers. Over the past 2 budget bienniums, we have been successful in allocating funding for school-based health centers, and that is both through the executive administration support and then the support of our legislative champions. And so in our first state budget as a kind of launch of our efforts to really increase investment in school-based healthcare, we were able to secure $15 million over the biennium for school-based health centers. So that went to the setup of planning, setup, and expansion of school-based health centers. This past biennium, we were successful in increasing that to $20 million, and that is going towards, again, increased expansion of school-based health centers across the state, new school-based health centers, and then sustainability efforts. So we're really excited to see that and are hoping to continue to drive that work forward. Next slide. So to give you a little bit of context around the Rural Health Transformation Project. So this was a nationwide initiative through the federal government where states were able to secure funding for specific projects that were intended or are intended to really transform rural health, increase and improve health outcomes and healthy living, among other things. So Ohio did put forth a proposal and they were awarded a little over, I think, $200 million in funding over a 5-year period to expand school-based health centers and many other things, including workforce initiatives and initiatives around pharmacy and technology transformation. And so school-based health centers were included as one of those priority areas in that funding and in that investment into Ohio. And so we know that there's going to be another $20 million that will be allocated to expand school-based health centers. The state is putting out requests for proposal across various initiatives. So two of those, two or three RFPs have already been released by the state to help allocate those funds from the Rural Health Transformation Project and the School-Based Health Center. School-Based Healthcare RFP has not yet been released, but we are anticipating that to happen in the next few weeks. So again, this is just another indicator of the investment that the state is making and the federal government is making in expanding school-based health centers and school-based healthcare. We have seen an increase due to increased investment in school-based health centers, and then also our role as a statewide organization to help support the sustainability and expansion of school-based healthcare, and then our many partners across the state that are really working towards expansion and sustainability of school-based healthcare. We've really seen an increase in the number of school-based health center sites over the years. And so we are about 2025, we're hitting about 140, almost 140 school-based health center sites. And we anticipate that that number is going to continue to grow as new sites are being developed. This is over the 24-25 school year. These are the counties that currently have school-based health centers. So you'll note that it's about a little less than half of counties in Ohio have a school district that has a school-based health center. Again, I'll let Katherine talk a little bit more about what that actually looks like on the ground. And then if you're interested, and I'll pop this into the chat box, we have a census on our website where you can look at the different counties and regions in the state and school districts and identify where school-based health center sites are. All right, I'm going to hand it over to Katherine to give you more information about, again, like the nuts and bolts of what a school-based health center is, and then how does that intersect with the populations that you serve.
Good morning, everyone, and thanks again to Groundwork for having us. We're always really excited to preach the gospel of this model that we know is impacting the students and families of the state of Ohio well. So we hope, I see some folks on the call who know this model intimately and have school-based health centers in your districts. Shout out to TPS. But some of you may not be as familiar. So just to caveat that I'm going to run through this content really quickly, but if you have additional questions or you're more interested in this, or you'd like to hook up districts or healthcare operators with us to talk more, we're very much available to do that. And we'll show you how to get more information at the end. So all of you on this call know well, right, that we are not meeting the needs of all our students and families in the state of Ohio. While we know this is a primarily 0 to 5 focused audience, your kiddos are very, getting ready for pre-K and getting ready for kindergarten. And we know that these problems that you see here in this slide, the roots of them begin in the 0 to 5 population. And part of why we're really focused on helping our school-based health centers welcome younger children and families to be part of their patient population is to get ahead of these problems. So a quarter of Ohio students are chronically absent during the 24-25 school year. I'll talk a little bit about the power of school-based health centers to disrupt chronic absenteeism and why they can really be a support in particular for some of the physical and mental health reasons that drive chronic absenteeism. And this is another one that you all know well in the positions that you serve in. Over half of children in our state do not report having a medical home. And so this is important for innumerable reasons. I'm sure you all are already strong believers in the power of preventive and primary care for students. But to not have comprehensive care, right? To not have the same provider that you're checking in with annually, to not have screeners being administered consistently, a lot is falling through the gaps. So school-based health centers are used in a variety of ways based on a family's need, but often they do serve as a medical home for families who are having a hard time accessing one in the community. They also help supplement if a family says, okay, we actually really love our home pediatrician, but my kiddo has asthma and they're supposed to get a chronic disease check every 6 weeks. And because of my work schedule and the bus routes and the hours our pediatricians open, that is really difficult. So school-based health centers are used not only as a medical home, but to supplement the care that a medical home is providing. And they're experts in weaving this care coordination around a child and family. So let's finally get at the definition. Thanks for bearing with us. If some of you on the call have not known what it is as we talk about its power and where they are, school-based health centers are a comprehensive primary care model based in the school that not only works on health outcomes, but also drives education outcomes and cost savings to our whole society. They have strong evidence for improving both health outcomes and education outcomes, such as reducing chronic absenteeism, increasing seat time. And we have some good national data too about graduating high school in 4 years and getting to reading at 3rd grade, all the important metrics that we know impact a human over the course of their life. So we, as Reem said, are a statewide nonprofit, nonpartisan organization. We work really closely with our colleagues at the Ohio Department of Health, and I see some ODH folks on here this morning. So just a huge shout out to the partnership that we're able to have with them. With their support, we were able to convene almost 40 organizations a few years ago to come up with a definition of what we mean when we say school-based health center in the state of Ohio. This doesn't, and I put in the chat, that map that we showed you, this is the model we're talking about, the brick and mortar model where you can open a door and walk in and you're inside a school building, but suddenly you're inside a doctor's office. This doesn't address the other alternative mechanisms of school-based healthcare that are prevalent across the state and really important. Things that you might have seen like mobile units or telehealth. There's all sorts of different models, and Reem's putting in the link here where you can peruse those at your leisure. Today, I'm just going to talk about the sort of most traditional school-based health center for which we have the most evidence around efficacy and sustainability. So that model comes with these 6 key components. First and foremost, it's on a school, the campus, inside a school building or on a school campus. This is sort of the superpower for disrupting that chronic absenteeism and allowing a student to remain where they are. Those of you who are parents know how much time it blows up in a kiddo's school day to bring them even for a quick appointment to the pediatrician. We also have folks particularly in rural areas where if one kiddo is getting picked up early to go to an appointment, all the siblings are getting picked up, right? And no one is probably coming back to school. So that on-site school presence where a nurse practitioner can see a kiddo if their throat is really hurting and they need a strep throat swab, or if their asthma is flaring and they need a nebulizer, is that superpower. They provide comprehensive primary care. We all know from going to our own general practitioners that they can't do everything, right? Sometimes we need a referral to a pulmonologist or a dermatologist. But if we say that school-based health centers are able to be a medical home, they need to provide the level of care up to what we see in a traditional pediatrician's office. So our school-based health centers are drawing blood work, they're doing labs, they're providing immunizations, and they're providing sort of comprehensive case management to get the kiddos and families to the other services that they might need. Continuity of care just means, well, your kids get sick at the most inconvenient times for you, right? So while some school-based health centers don't have providers 5 days a week, that's what the goal is, right? Is to have either a nurse practitioner or PA or a physician on site all the times that kids are in school, because you don't just get strep throat on a Tuesday and Thursday, right? And you don't just get injured on a Friday morning. And so continuity of care is the key component, again, that really contributes to those academic outcomes and allows kiddos to get the care they need and back to their seat in their classroom as expeditiously as possible. Compliance and consent means that school-based health centers adhere to all state and federal laws, the same as any other primary care practice. So here we tell you that the vast majority of patients at a school-based health center are seen without their parents in the room. And that is why they remove so many barriers to families that are struggling to access primary care, but that families are a key part of the process. So, as Brittany mentioned, I'm a nurse by training. I had the great privilege to run school-based health centers for much of my career. And I actually prided myself on how available we were to parents. So parents are able to attend any visit they want. We can bring them in on via a telehealth link. They can sit on speakerphone so that their kiddo can feel comforted by their virtual presence. And providers really are able to talk with parents comprehensively before and after the visit to loop them into the plan of care and get all the information that they need. No children are ever seen at a school-based health center without parental consent as well. So Reem showed you the map of all the schools where students are offered this option. Not every family in the school district takes them up on it, and that is a-okay, right? So when we talk about goals for school-based health centers, we like them to have about 75% of the student body consented for services. Some will use them for that strep throat that I mentioned, or a concussion that they got in sports practice the night before. Some will use them for all their primary care. It's sort of a choose your own adventure. Partnership means that school-based health centers are not a conveniently located urgent care, right? They're not just plopped in a school building and the staffs don't interact. They really, the school district, and I'm sure our representative from Toledo Public Schools could echo this, is a crucial partner with the healthcare operator. And the school district is the expert on the students and families they serve, right? School nurses know which kiddo is actually going to the ED several times a winter for their poorly controlled asthma symptoms. They know which family is facing persistent food insecurity at home. They're the expert. And so the healthcare operator has the great benefit of coming in and supplementing the services that are already offered in the school, right? Extending the care that that school nurse is providing, collaborating with the school counselors and psychologists to offer even more services. And what they're offering is all based on a robust community health needs assessment that they undertake with the school district to sort of map assets and opportunities. We build on that when we talk about system alignment, right? So we really want these two systems driving towards the same goal. I say this is the healthcare model that requires the most interpersonal functioning between adults of perhaps any, maybe the OR, but we really have to work super closely together and make sure that we're designing schedules that accommodate high schoolers' requirements, right? We're not making kiddos miss a math test to come see us. We are collaborating really well with those existing experts in the building, and that we have those academic goals first and foremost, just in partnership with the health goals. So that's normally like an hour-long presentation. So thank you for sticking with me while I blitz through it. I could talk about this forever. I'm just going to quickly give you some results. We are closing our last year's census right now. So we're collating all the data from our amazing healthcare operators around the state. So this is a year old. This is from the 23-24 school year. And not all of our school-based health centers are represented on this metric slide, as you can see. But in just 110 school-based health centers, they served over 50,000 patients from 0 to 18. And many of them are serving adults too, so that's not the whole patient population. And as you can see, at just 98, they completed over 20,000 well-child visits, which is just sort of the core component of primary and preventive care in the pediatric population. So they punch above their weight. And then here's what we really want you guys to walk away with, right? Is that school-based health centers, while the requirement of being a school-based health center is that you serve the students in the school building, they're also a really welcoming place for family and community. So depending on the memorandum of agreement, a memorandum of understanding with the school district. Many of them also see school staff, which those of you who are teachers can understand how valuable that might be, right? To be able to run down in your free period and get your blood pressure checked or get your thyroid medication adjusted. Many of them also see families. So if you are mom dropping off in the morning and you want to park your car and run in for your, adjustment on your medication, or bring your 3-year-old in for the gunk coming out of his eyes this morning. This is already a place that you're really comfortable, that you're accessing regularly. They're very easy to make appointments at. They're very flexible. And then almost half serve the general community too. So this becomes incredibly important in our rural swaths of the state, in particular Appalachia, where there's not a lot of primary care options. This is achieved through really thoughtful, safe mechanisms like an external door, a second lobby, lots of security so that we're making sure that our students in school buildings are safe while offering this option. So we think that this is a place that we really would like to see that 68 serving students, families get up higher and higher and higher because we know that while kiddos are can be seen at these settings right away for their like post discharge weigh-ins, right? For breastfeeding help, for management of allergies and chronic issues, for their pre-K checkups. It's really a place that is student-centered and family-centered, and we think that it's a really smart. Some of my favorite patients I ever saw were getting their physicals for their pre-K, and for kiddos to already start to feel comfortable and already feel empowered about their own health, feel comfortable walking into the elementary school that they're going to attend. We think it makes a lot of sense. It's really helpful for families and reduces barriers for busy parents. Okay, if this was at all attractive to you or you're interested or you want to know more, we have lots and lots of resources on our website. Our Startup 101 toolkit goes through everything I talked about in a lot more detail and helps you understand if this might be a good fit for the community that you're serving. This is the way to get into our newsletter and find all our social media. We have lots of rich content, so we'd encourage you to sign up if you're interested. And I know we have 4 minutes, Brittany. One quick plug. Friday, our registration closes for our conference, which happens Thursday, February 5th, in Polaris in Columbus. I think I've been to a lot of conferences. I bet Groundwork, you compete with us for this. I think it's the nicest group of people in any room ever found, right? Because they're people that care about kids and families and health and education outcomes. So if this is a model that you're interested in, we'd love to meet you in February. And Reem also put the link in there for the registration. So 3 minutes. If anyone has questions, we'd love to hear them and also happy to continue to be available to you after this call.
I'm gonna second what Catherine said in that I think that any group of folks that centers around kids has just got to be the best group of get best group to work with and just the most caring. So we have a bias, obviously, but any questions that you all have, we're happy to answer. And there's tons of resources on our website as well, and also happy to connect after this meeting today if you have additional questions. But we'll turn it back to the Groundwork team
And
to
I'll
help
just take
facilitate.
Todd's question really quick. Todd, I'm happy. I'll grab your email
Oh, yeah.
and send you some articles. Basically, and our evidence was really slow during COVID, so we have some old evidence around this. It's basically just the idea that the more we can keep a kiddo in their chair in those formative kindergarten, first, second years, the more likely they are to be able to meet that third grade reading promise. But I'll get you some follow-up on that.
Thanks, Catherine. And we'll make sure we include the links from the chat in our follow-up email as well. I see another question coming through from Amanda.
Oh yeah,
Um,
sure. Amanda, I can take that. Yeah. And oh, thank you for doing that job. It's the hardest one in the building. So it really depends. Amanda, most times school-based health centers that see students and an outside population have two doors, right? So there's one into the school building that students are accessing through, and then there's an external door, perhaps with some reserved parking spots, and an external lobby that's locked. So because school-based health centers are HIPAA compliant spaces, we don't want community members actually having to check in through school staff because that could be perceived as a HIPAA violation, but they are checking in through clinic staff. So the most common way I see that done is that certain hours in the day are reserved for community members, usually those after school hours, and that during the school day, that's reserved for students, staff, and family members. But always happy to dig in with you further on that.
Thanks, Catherine. I bet we have time for one more question. If anybody wants to be bold and pop off mute, feel free. And if not, that's okay. Okay. just some appreciation for the answers. Well, we appreciate y'all spending your morning with us so much, and the work that you do is incredible. And um, while we talked a little bit about some of it, a lot of this conversation is around older kids. It's the health of our communities, it's the health of our young children, of our parents and caregivers and families, and it all connects. So we really appreciate what you do to strengthen, a community's greater sense of health here across Ohio, and are cheerleading for you all to continue seeing those counties light up on that map that you showed us at the beginning. We'll share every link that we had this morning. Encourage folks to register for the conference by tomorrow. And we will also be, thank you so much, Reem. Next week, we'll be back with Cincinnati Preschool Promise. Shara Fisher Jackson, their CEO, will be coming to chat about their recent successful levy campaign that drove more dollars to the local early learning system there. So thank you, Katherine. Thank you, Reem, for the incredible work that you do, the incredible advocacy you do for Ohio's children. And we look forward to continuing to partner with you in the future. Have a wonderful morning, everybody. Thank you.